Hello, everyone. I hope you all are doing great. I welcome you all to this meeting. I am honored to welcome Dr. Khubaib, who graduated from Ayub Medical College, Abbottabad. Thank you so much for joining us. Could you please brief us on cardiac ischemia and what causes it?
Thank you so much, Amna, for inviting me. Cardiac ischemia is basically an interruption of oxygen supply to the tissues of the heart muscles. So ischemia is basically reduced blood flow, right? Uh, the causes of cardiac ischemia it's basically decreased blood flow or oxygen supply. There are a number of risk factors involved in this, which can be divided into modifiable and non-modifiable risk factors. Now, modifiable risk factors would be something that you're born with, right? And it could be your age. It's something you cannot modify, and it's bound to happen. It could be the gender or the race or some metabolic syndromes that basically are genetic mutations in a person's genome. And then there are modifiable risk factors which you can stop from happening, which would decrease your chance of getting an MI or the ischemic heart disease. Now, these would involve something like
Thank you so
your
much.
weight. Oh, okay.
Yes, sorry. Continue. You may continue.
Okay. So if I'm speaking a bit too much on something, you may stop me from doing so. I wouldn't mind. It's
No,
okay.
I thought you were finished with your answer.
Now, so then we come to the modifiable risk factors, in which would be sedentary lifestyles. It could be a person's weight. Two of the most important risk factors are smoking and diabetes and hypertension. These are some things that we can control and would decrease our risk of getting an ischemic heart disease.
Thank you so much. Now, Ilham would like to ask you a question.
So the prevalence rate of cardiac ischemia is quite high in Pakistan. It is 17%. So how do you think we can improve it?
In community medicine, we learned about something called primordial, primary, secondary, and tertiary prevention. Primordial prevention is something that something where you prevent something from happening before an onset is seen. For example, it's basically teaching children to improve their lifestyles and to incorporate sports into their lifestyles. Then we have primary prevention, which is something where somebody has a risk factor and you have to protect that certain demographic from being liable to getting an ischemic heart disease. Now, prevention is always better than cure. So first we have to prevent it from happening by decreasing the risk factors that I just described, the modifiable risk factors. So it would be having a healthier diet, decrease smoking, or basically stop smoking altogether, controlling your hypertension, controlling your sugar or diabetes, and the other risk factors that I just described.
Thank you so much. Our last question is that what treatments are specified for cardiac ischemia?
There are a number of treatments, so we could divide it into medical and non-medical treatment, or we can also just talk about prevention. So we could say prevention, medical treatment, and then non-medical treatment. Prevention we just talked about. Medical treatment would include, it would basically include medications that would stabilize the heart. So to decrease the oxygen demand of the heart, what we could do is we could decrease its activity. So we could give it medications where it would stop beating faster, which would be some medications called beta blockers. We could decrease a person's blood pressure or control it by medications that are called antihypertensives, which are ACE inhibitors, beta blockers, or thiazide diuretics, and aspirin, and there are a number of other medications. And then we have non-medical treatment or surgical interventions that are basically mostly done in after a person has had a myocardial infarction, and that will be something like coronary angiography or percutaneous interventions.
Thank you so much.
Thank you so much for enlightening us on this topic.
No,
We're very grateful. Thank you so
no,
much.
it's okay.
Have a
If you
great
have
day.
if there is anything that needs to be cleared, you can ask me.
Do you guys have any questions?
No, I don't have.
Adam, do you have any questions?
No.
Okay. I would like to ask you a question,
Sure, go on.
if that's okay.
Yes, go on.
Why do you think regular checkups are not very common in Pakistan?
I think it's because of the education, because I work in a hospital in Abbottabad, right? And most of the patients we see basically neglect common common complications they have had with their health. And so that's what all of us in Pakistan do. We would see something growing on our foot or on the occasions until it gets really, really bad. So, for example, my last rotation was in dermatology, and we would see a patient that would have a third stage of cancer or fourth stage of cancer, and would be pretty bad. And when we would ask the patient why they presented to the hospital so late, they would say that it was just some small ulcer that was growing on their face or on their foot, and they were applying medications, or they did not know of it and thought it would clear up, and then it didn't, and now it was causing pain. And when biopsy is done or when investigations are done, the patient has already progressed to the last stage of the disease. So I think lack of education and lack of attention, and also we could also say that healthcare is basically a privilege to most of the people. Most people are not given this privilege, and I think these are some of the factors I think that people do not get healthcare.
Self-medication is really, really common in Pakistan, right?
Yes, it is really common.
Thank you so much.
No worries.
Have a great day. Thank you. Take
Thank you
care.
so much.
Allah Hafiz.
Allah Hafiz.